According to the American Cancer Society, there's a 1 in 8 chance a woman will develop breast cancer. To learn how to reduce your risk of developing this common cancer for women and to increase the likelihood of survival, we spoke with Dr. Monica Valero, a breast surgical oncologist at Beth Israel Deaconess Medical Center and the director of BIDMC's Hispanic Breast Cancer Program, about what steps you can take.
Non-modifiable risk factors include the age, the ethnic group, the breast characteristics, early menarche and late menopause. But within the modifiable, we know we have the changing in reproductive patterns, use of postmenopausal hormones, smoking, alcohol, nutrition, and exercise.
To lower your risk, experts recommend maintaining a healthy weight, being physically active, avoiding or limiting alcohol, not smoking, and avoiding fat.
There are no signs or symptoms associated with breast cancer until a palpable or a visible mass develops within the breast. So the most common physical sign that can be appreciated is a painless breast lump. Okay, and usually patients detect these when they're like in the shower or when they're doing the breast exam, if they do like a monthly breast exam. Also, they can identify like a swollen or enlarged lymph nodes in the axilla or under the arm. Which usually when this happens, usually is like a more advanced stage of disease. It also can present as an evidence of like a bloody nipple discharge or redness, swelling, deformity, retraction. Those are less common signs, but definitely they can happen. And those are like an indicator or a malignancy or more evident advanced stage of disease. For those patients that don't present any symptoms, like have like a non-palpable lesion or non-palpable mass or non-palpable abnormality in the breast, that's where like the screening mammograms plays a very important and impactful role, because breast cancer can present in a non-palpable way, and the only way to identify this abnormality will be through imaging. Screening mammograms are the best way to screen patients to identify malignancies at an early stage. So that's one of the key features that we have to keep in mind in terms of like prevention. That's something that is recommended for patients, between the 40 and 70 years. There are 3 main guidelines in terms of how frequently mammograms should be performed, but it's the recommendation that we follow is that patients should receive screening mammograms yearly to identify breast cancer in the early stage.
When breast cancer is detected in its early stages, it is easier to treat and there is a better prognosis.
The most common ones that I recommend my patients to go to find more information is the American Cancer Society. Within that website, they can find information specifically on breast cancer. And also the website from the ASBS, which is called Breast 360. That's a website that also has a very reliable and good information.
For the Needham Channel News, I'm Ashley Morin.